Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Melissa Duchesne. Thank you, Melissa, for joining us this morning.
Thanks for having me.
You're welcome. Okay, today we are talking about strokes. Very serious topic. So first of all, tell us, what is a stroke and who do they impact?
So there's two different kinds of stroke. There's a hemorrhagic stroke, which is actually bleeding in the brain, and then there's an ischemic stroke, and that's a blockage in the brain that deprives your brain of blood and oxygen.
So Melissa, what do people need to look out for with their signs and their symptoms of stroke?
So we use the acronym. There's a couple acronyms, and the most one that they are most familiar with is FAST. So face, arm, speech, and time. So looking for anything unequal in your face. Usually people will smile if their smile looks unequal. Arms, if there's any weakness in your arm, any sensory loss, so something just doesn't feel right. And then speech, if you're not speaking correctly, things are coming out slower than normal. And then time is really calling 911 because it's really important, and time is of essence to get to the hospital so we can give you life-saving treatment.
And I always say every second counts when it comes to a stroke. So if someone is experiencing some of these symptoms, tell us, how do they recognize it and what should they do if it's themselves or if it's a loved one?
Well, I always say if they feel like there's something that's not quite right, they should really come in and get it checked out. We use the acronym BFAST here because there's strokes that can happen in the backside of the brain, and sometimes those can have symptoms that are a little bit different than the common symptoms of stroke, and so it could be more like vertigo type symptoms, so people might feel like their balance is off. They might have some visual deficits. And I always just say, if something's not right and someone's just not acting right, they need to come in and seek medical help and make sure everything's okay. It's really important to know what time they were last seen normal. That's a very important thing for us to know as providers here at the hospital.
And it's so important right now, Melissa, to get help when you need it. But people are a little bit afraid of the pandemic. They don't know what to expect. So what can you say just to ease their fears about that during this time, getting help?
What I always tell people, I feel like you're safer here. We're doing all the right precautions. People here are wearing, we put a mask on everybody. We're all wearing masks. You're very protected here at the hospital, and if you sit at home, we can't help you. We can give you medication, but it's within the first 4.5 hours of your symptom onset. And sometimes they can do intervention, but that's in the first 24 hours. But if you sit at home, sometimes people are left with those disabilities and then we can't help them. But we can help a lot of that if they can get to the hospital in time, and they really need to do that because it is safe to come in. I know people are afraid of it, but you're safer here than even out in the, sitting at home and having a stroke and not knowing if, well, maybe this will go away. It's probably not going to go away. You need to just come in so we can help you.
Yeah, don't hesitate. It's better to be safe than sorry, as they say. And Melissa, anything else that you want the community to know about strokes during this time?
No, just the importance of calling 911. Calling the ambulance to get here actually gives us more alert and awareness that they're coming in and gets them right to the back. Sometimes the story doesn't get out correctly. If they come in by the front doors, they might be telling the story a little bit different, and so somebody might not pick up on it. But calling 911, plus they have all the measures in place if something were to turn bad. So instead of driving to the hospital, you should call 911 and you should get help and come in. Worst thing, you could go home if nothing's wrong. So I say come in, get help, and then you can go home if it's okay.
I love that. That's so true. Melissa, thank you so much for calling in and for this valuable information.
Yes, thank you.
You're welcome. So make sure you do not hesitate if you do feel any signs or symptoms. For any additional information on today's topic, head on over to the Hot Links page on WNEM.com.